The cartwheel, a common trick, looks simple at first glance, but what is the body really doing in a cartwheel?
Let's have a look at 6 vital positions that break down the general motion. We're going to focus on the knee, hip, and shoulder, the most important parts needed to perfect a cartwheel. The cartwheel starts off with the right arm abducted and left arm mildly abducted relative to the axial skeleton across the glenohumeral ball and socket joint on the frontal axis. In this motion, the agonist is the deltoid muscle, which originates on the clavicle and the acromion process of the scapula and inserts into the deltoid tuberosity of the humerus. The supraspinatus muscle is also an agonist because, as part of the rotator cuff, it is prime mover in abduction at the shoulder joint. It originates on the supraspinous fossa of the scapula and inserts into the greater tuberosity of the humerus. The antagonists of this motion are the latissimus dorsi and the teres major. These two muscles relax while the agonists contract. While both arms are abducting, they are simultaneously drawn towards the midline on the transverse plane. The agonist is the pectoralis major, originating on the sternum and the clavicle and inserting into the bicipital groove of the humerus. The main action of the pectoralis major is arm adduction. The antagonists are the latissimus dorsi and the rhomboid major.
The left thigh flexes relative to the trunk across the acetabulo-femoral ball and socket joint on the sagittal axis to raise the left leg off the ground. The agonists are the iliacus, originating on the iliac spine and inserting onto the lesser trochanter of the femur. Also the psoas major, which originates on the transverse processes of the lumbar vertebrae and also inserts into the lesser trochanter. Together, the iliacus and the psoas major create the iliopsoas. Also the sartorius, which originates on the lateral iliac spine and inserts into the shaft of the tibia. And finally, the rectus femoris, originating on the ilium and inserting into the tibial tuberosity via the patella. The antagonists of this motion are the gluteus maximus and the biceps femoris. There is also mild flexion of both lower legs relative to the thighs across the tibiofemoral hinge joint on the sagittal axis. The agonists in the leg movement are the semitendinosus, originating on the ischium and inserting into the shaft of the tibia, the semimembranosus, originating on the ischium and inserting into the medial condyle of the tibia, and the sartorius. The antagonists are the vastus medialis, the vastus intermedius, and the vastus lateralis.
In the second position of the cartwheel, lateral rotation of the left arm occurs on the rotational axis of the humerus at the glenohumeral joint. The agonists are the posterior fibers of the deltoid, the infraspinatus, originating on the infraspinous fossa of the scapula and inserting on the greater tuberosity of the humerus, and the teres minor, originating on the lateral border of the scapula and inserting on the greater tuberosity of the humerus. The infraspinatus and the teres minor are both part of the rotator cuff and help with lateral rotation of the arm, while the deltoid works with these two muscles to support the action. The antagonists are the anterior fibers of the deltoid and the subscapularis. At the same time, the right arm is medially rotating on the rotational axis of the humerus across the glenohumeral joint. In this motion, the agonists are the anterior fibers of the deltoid and the subscapularis. The antagonists are the posterior fibers of the deltoid, the infraspinatus, and the teres minor.
In the third position, both arms fully abduct over the head on the frontal axis across the glenohumeral joint to brace his body weight upside down. The agonists in this movement are the deltoid, the supraspinatus, and the trapezius, which originates on the cervical and thoracic vertebral spines and inserts into the clavicle and the scapula. The antagonists are the latissimus dorsi and the teres major. The thighs in this position have returned to anatomical extension relative to the trunk across the acetabulo-femoral joint on the sagittal axis. The agonist is the gluteus maximus, abducting the thigh. The antagonists are the iliacus, the psoas major, and the sartorius. Both lower legs are fully extended relative to the thighs across the tibiofemoral joint. The agonists are the rectus femoris, the vastus medialis, the vastus intermedius, and the vastus lateralis. The antagonists are the biceps femoris, the semitendinosus, and the semimembranosus.
Both legs are abducted from the midline across the acetabulo-femoral joint on the frontal axis. Here, the agonists are the tensor fasciae latae and the iliotibial tract, which originate on the iliac crest and insert into the tibia. Also the gluteus medius, originating on the iliac spine and inserting onto the greater trochanter of the femur, and the piriformis, originating on the sacrum and inserting on the greater trochanter of the femur as well. The antagonists are the adductor magnus, the adductor longus, and the gracilis.
In the fourth frame, both arms are adducted across the glenohumeral joint on the frontal axis until perpendicular with the axial skeleton. The agonists here are the latissimus dorsi, the teres major, and the coracobrachialis, originating on the coracoid process of the scapula and inserting on the shaft of the humerus. The antagonists are the deltoid, predominantly the lateral and posterior fibers, and the supraspinatus. There is also lateral rotation of the right arm across the glenohumeral joint on the rotational axis of the humerus. The agonists here are the posterior fibers of the deltoid, the infraspinatus, and the teres minor. The infraspinatus and teres minor are both parts of the rotator cuff that help with lateral rotation, while the deltoid abducts the shoulder. The antagonists in this movement are the anterior fibers of the deltoid and the subscapularis. Simultaneously, there is flexion of the trunk toward the right side, using the right external and internal obliques. The left external and internal obliques are the antagonists in this motion. Lastly, there is also lateral rotation of the right leg across the acetabulofemoral joint on the rotational axis of the femur. The agonists in the movement are the gluteus maximus and the piriformis. The agonists abduct and laterally rotate the thigh. The antagonist is the gluteus medius.
In this frame, there is mild flexion of both forearms across the elbow hinge joint on the sagittal axis relative to the humerus. One agonist necessary to flex the arm are the biceps brachii, which originates on the coracoid process of the scapula and the supraglenoid tubercle of the scapula and inserts into the radial tuberosity. Another agonist is the brachialis, originating on the humerus and inserting into the ulnar tuberosity. The muscle that relaxes while the agonists contract, or antagonist, is the triceps brachii.
Additionally, both arms are adducted across the glenohumeral joint on the frontal axis relative to the axial skeleton. For this motion, agonists include the latissimus dorsi, teres major, and the coracobrachialis. Antagonists are the deltoid and the supraspinatus. In this frame, you can also see that the left arm is drawn backward by shoulder extension relative to the axial skeleton across the shoulder joint after forearm flexion. Agonists are the latissimus dorsi, teres major, and the posterior fibers of the deltoid. The antagonists are the anterior fibers of the deltoid and the pectoralis major. The right shoulder is flexed relative to the axial skeleton as well, which requires the contraction of the anterior fibers of the deltoid and the pectoralis major. Here, the latissimus dorsi, teres major, and the posterior fibers of the deltoid are the antagonists.
At the same time, there is adduction and flexion of the left thigh toward the midline in order to return close to anatomical position across the acetabulofemoral joint. The agonists are the adductor longus and the pectineus, originating on the pubis and inserting on the shaft of the femur. The antagonists are the gluteus maximus and the gluteus medius. There is also flexion of the right thigh to raise the leg off the ground at the acetabulofemoral joint. The agonists are the iliacus, the psoas major, the sartorius, and the rectus femoris. The antagonists are the gluteus maximus and biceps femoris.
Lastly, in this position, there is mild flexion of both lower legs relative to the thighs across the tibiofemoral hinge joint, though only the right foot is raised off the ground. The agonists are the semitendinosus, the semimembranosus, and the sartorius. The antagonists are the vastus medialis, vastus intermedius, and vastus lateralis.
In the final position, both forearms are fully extended relative to the humerus across the elbow hinge joint on the sagittal axis. The agonist is the triceps brachii, extending the arm. The antagonist is the biceps brachii. The right shoulder is extended back to anatomical position relative to the axial skeleton across the glenohumeral joint on the sagittal axis. The agonists are the latissimus dorsi, the teres major, and the posterior fibers of the deltoid. The antagonists are the anterior fibers of the deltoid and the pectoralis major.
The right leg medially rotates on the rotational axis of the femur to return to anatomical position across the acetabulofemoral joint on the sagittal axis. The agonist is the gluteus medius, and the antagonists are the gluteus maximus and the piriformis. The right thigh extends relative to the trunk in order to return to anatomical position across the acetabulofemoral joint. In this movement, the agonist is the gluteus maximus, and the antagonists are the iliacus, psoas major, and sartorius. At the same time, both lower legs extend relative to the thighs back to anatomical position across the tibiofemoral joint. The agonists are the rectus femoris, vastus medialis, vastus intermedius, and vastus lateralis. The antagonists are the biceps femoris, semitendinosus, and semimembranosus. And there you have it, the cartwheel.